Welcome friends. Today we will discuss about introduction to diabetes. So, starting with learning objective. So, after completing this topic, student will able to understand the concept of diabetes, functions of pancreas, then different types of diabetes, how diabetes was diagnosed, what are the parameters for diagnosis of diabetes, and what are the risk factors associated to induce or to increase the chances of occurrence of diabetes. So, prior to understand what is diabetes, we have to understand the physiology of pancreas. So, pancreas, it is a gland which act as a both type of gland, that is exocrine as well as endocrine gland. Exocrine pancreas help in the digestion. It produces digestive enzymes, whereas endocrine gland of pancreas produce peptide hormones such as insulin, glucagon, and somatostatins. The peptide hormone are secreted from cells located in the islets of Langerhans. So this figure gives idea about location of pancreas, and it is attached with duodenum as well as with bile duct. So pancreas contain different cells. Beta cell produce insulin. Alpha cell of pancreas produce glucagon. Delta cell of pancreas produce somatostatin, and F cell produce pancreatic polypeptides that helps in the digestion process. So these hormones play an important role in regulating the metabolic activities of body, particularly the homeostasis of blood glucose. So this is about pancreas, and in case of diabetes, the most important cell is beta cell, which produce insulin. So first we have to understand what is a diabetes. So if I question what is a diabetes, what kind of reaction do you give? So diabetes mellitus, it is a group of metabolic disorders of fat, carbohydrate, and protein metabolism that result from defect in insulin secretion, insulin action, or sometimes both. So diabetes is characterized by hyperglycemia, that is increase in plasma glucose, polyuria, that is frequent urination, polyphagia, increase in hunger, and polydipsia, that is increase in thirst. So these are the characteristic features for identification of diabetes. So diabetes was divided into different types. Majorly, there worldwide two types of diabetes are well recognized. Type 1 diabetes, that is called as insulin dependent diabetes mellitus, means insulin is deficient in case of type 1 diabetes. Number 2, that is type 2 diabetes. It is also called as NIDDM, that is non-insulin dependent diabetes mellitus. It develops either because of insulin resistance or deficiency in insulin secretion. Third type of diabetes is occur during pregnancy. It is called as gestational diabetes. And later, some types of diabetes are discovered that are developed because of genetic defect or some medications. Majorly, type 1 and type 2 are associated with microvascular and macrovascular complications such as cardiomyopathy, retinopathy, neuropathy, nephropathy. So these are the different pathies are developed because of type 1 and type 2 diabetes, that is micro and macrovascular complications. So type 1 diabetes. Type 1 diabetes is autoimmune disorder developing in childhood or in early adulthood. That's why it is called as juvenile onset. Type 1 starts below 20 years of age. It is autoimmune. Autoantibodies destroy pancreatic beta cell. In type 1, there is no necessity that patient is always obese. Patient is non-obese. Type 1 diabetes mellitus accounts for up to 10% of worldwide diabetes mellitus patients. Whereas type 2 diabetes starts after 40 years of age. In type 2, insulin deficiency or insulin resistance was developed. Obesity is one of the risk factors for increase the chances of type 2 diabetes. Then type 2 diabetes mellitus is account for 90% of all diabetes cases. Means type 2 diabetes is a serious problem worldwide where 90% of world diabetic population is affected with type 2 diabetes mellitus. Gestational diabetes. This type of diabetes was developed during pregnancy, and as pregnancy or delivery takes place, the diabetic symptoms are reduces. This developed because of glucose intolerance. Most women will return to normoglycemia postpartum, but 30 to 50% will develop type 2 diabetes mellitus or glucose intolerance in later life. There are some other types of diabetes that may be due to genetic defect. MODY, that is maturity onset diabetes of youth, is characterized by impaired insulin secretion with minimal or no insulin resistance. Patients typically exhibit mild hyperglycemia at early age. In this case, genetic inability to convert proinsulin to insulin result in mild hyperglycemia and is inherited in an autosomal dominant pattern. So, how one can diagnose diabetes? What are the parameters for considering the normal level of glucose, pre-diabetic and diabetic level? So, in this case, there are two parameters was considered: FPG, that is fasting plasma glucose, and OGTT, that is oral glucose tolerance test. So these are the different markings where one can easily identify the plasma glucose. In case of fasting condition, normal plasma glucose is below 100 mg per dl, while pre-diabetic was considered as 100 to 126 mg per dl. So, the fasting glucose in patient suffering from diabetes is more than 126 milligram per dl. Whereas after meal or after oral glucose tolerance test, the diabetic patient was considered whose plasma glucose is more than 200 mg per dl. If the patient is normal, means the plasma glucose has to be below 146 mg per dl in case of postprandial plasma glucose, that is after meal. So, what are the risk factors associated with diabetes? Or which are the different conditions that provoke the chances of development of diabetes? The first one is insufficient physical activity. 20 to 30% increase risk of diabetes. Those they don't do physical activity, walking, running, yoga, at least people supposed to give 30 minutes of their daily time for their physical exercise, that reduce chances of development of diabetes. Second risk factor is harmful use of alcohol. So consumption of alcohol and cigarette may increase the chances of diabetes as they produce free radical, and free radical induced damage may disturb physiological function of pancreas. Third risk factor is obesity or overweight. So obesity increase the chances of insulin resistance. Last is cholesterol level, that is increase in cholesterol. It is also a risk factor for diabetes as it causes insulin resistance. So the question comes in mind after aware about diabetes, how one can treat diabetes, what are the therapeutic targets to treat hyperglycemia or diabetes. So these are the some therapeutic targets. First one is insulin secretion. So we have to increase insulin production. So in this case, sulfonylureas, meglitinide, incretins are useful. Next criteria is glucagon secretion. So glucagon help in increasing plasma glucose. So we have to suppress that glucagon. So incretins and amylins are helpful. Then controlling the appetite. Incretins are helpful. Then glucose reabsorption. So presently the newer drug comes in a market, that is SGLT2 inhibitors, that reduce reabsorption of glucose. Then increase glucose uptake in skeletal muscle, that can be done by thiazolidines and metformins. Then lipotoxicity can be reduced by application of thiazolidinediones. Then certain drugs that reduce hepatic glucose output, metformin can be useful. And the best drug that controls entry of diabetes through diet, that is through gastrointestinal system, alpha glucosidase inhibitor. So these are the different therapeutic targets for controlling hyperglycemia. So you are watching Dr. Navagare's Pharmacology. Please subscribe the channel. Thank you.